Hello, welcome back to my channel. For those of you that don't know me, my name is Lauren, and I'm high-functioning autistic. And my channel was originally created to educate others about the side effects of high-functioning autism and to share my experience. And for the most part, I try to do that. And as most of y'all know, I've been writing a book and a memoir or a biography, whatever you want to call it, about my life with autism. But today is September the 2nd, 2023, and I want to talk about a condition not including autism, totally different. September is Interstitial Cystitis Awareness Month. And why am I talking about interstitial cystitis? Actually, I was given a diagnosis of the disorder from my gynecologist back in 2004. I was 22 years old and almost 23. First off, I want to say about what IC is. IC is a bladder disorder. They really don't know what causes it. It's more common in middle-aged to older women, but it can affect men and children as well. Its symptoms include urgency, like you feel like you have to pee now and you have to go a lot. Pain when you urinate, just like you would a urinary tract infection. Their symptoms are intermittent. You also have pain and discomfort down in that area, and it is really debilitating. In addition to urinary urgency and frequency, urinary hesitancy is also a symptom. And another overlapping condition that is often confused with IC is a condition called Vulvodynia. It feels like a burning sensation in your private parts, and when that happens, you can have symptoms that would overlap with interstitial cystitis or be confused with interstitial cystitis. And also a combination of both of them would be a deep ache in your pelvic area, and some people with IC get abdominal cramps and where your bladder is. How do they diagnose IC? IC and all of its disorders are really kind of complicated to diagnose, and there's really no one specific test to diagnose it. They used to say that the gold standard of diagnosing IC would be to do a cystoscopy. That's where they look in your bladder, and usually what they do, if they want to really get a good look at your bladder, they fill it up with something and they stretch it out, and you can usually see irritation in your bladder. A lot of IC patients, me including, have a normal interior of the bladder. A small number of people with IC have what's called Hunter's ulcers in your bladder, and that's the worst type of IC, but fortunately that one is less common than the type that I have. So let's go on to treatment for IC. What is some of the treatment for it? Elmeron, which is one of the medications, which I wouldn't recommend taking that stuff because it's really expensive, and I don't feel like it helped any of my symptoms as much as I would have liked it to. Also, a Neurontin, which is referred to as gabapentin in its generic name, and Elavil in its generic term is amitriptyline. My new women's healthcare provider suggested Singular for IC, and I was like, an allergy medicine for IC? She said that she noticed with a lot of her IC patients that Singular seemed to help them. And why would Singular help IC? Because sometimes food you eat can trigger or worsen IC symptoms, especially foods that are typically allergen producing for most people. I didn't really like singular either. So about my story with IC, if you want to hear it, it was really challenging to diagnose my IC when I was little. I had IC symptoms on and off for as long as I can remember. I was probably right around toddler age or slightly older when I first noticed that I had symptoms of IC and Vulvodynia. My symptoms of IC from as long as I could remember were a burning in my private area, which was consistent, and it mostly happened at night. With that burning, it really made me feel like I need to go pee more often. Seems like urinating would temporarily relieve the burning down there. And also, when I was little, I had urinary urgency and frequency, and I got in trouble a lot for peeing in my pants. Nowadays, Mom regrets that she spanked me for peeing in my pants, and I wasn't really able to explain it when I had the burning sensation. When I was little, what I would do is I would kick and squirm all night long, like whoever was with me, and it felt like I had to have something like between my legs to cool off the burning sensation a little bit. I also had a little bit of urinary hesitancy. I would feel like if I go to the bathroom, I would have to pull my pants all the way down to my ankles and not to my knees. If it just goes to my knee, then it feels like I can't urinate if I'm having hesitancy. My autism made it difficult to explain, and I suffered from these symptoms for 20 some years, and Mom didn't. She knew I had a bladder problem, but she didn't realize how serious it was until I got older. But anyway, I didn't really have a real problem with bedwetting when I was little, but when I got to high school, I developed a really bad problem with bedwetting, and it was really frustrating because I couldn't lay down, like take a nap without peeing on anything. And every time that I would lay down in our recliner or even in my bed, or even if no matter or where I would sleep at, I would pee in the bed. And they thought it was my medication at the time that was making me do it. And I knew that I'd always had some kind of bladder problem, but I didn't know how to explain it. And sometimes, like, I got treated like I was not wanting to deal with it, and I got told, well, I'm too big to pee in my pants and all that when I had my bladder problem. And I finally started telling Mom when I got older that part of the reason that I couldn't sit still sometimes when we had to sit still for long periods of time, or at night when I was trying to sleep, would be because I had this burning down there. And she'd be like, Lauren, I always knew something was wrong, but I just didn't know what to do. And like when I had the Vulvodynia burning sensation, I wasn't really able to explain it because it was really odd to explain because you didn't know where the pain was coming from down there. Explaining that when I was younger was more difficult than explaining like spraining your ankle or whatever, or falling and skin on your knee and like there's blood everywhere. But explaining this was different, and I wasn't allowed to complain about private stuff. It was almost like it was taboo. And I don't know, I just kind of don't agree with the way sometimes that I was treated for my eyes. I think because I didn't know how to explain it clear, and even when I did, I felt like people thought that I was just making things up to try to get attention. If I would mention it, like, there's nothing wrong with you, you're too big to act like that, and all that. Well, a lot of autistic people get that, I think. I would have to go to the bathroom a lot in school, and teachers really got annoyed with me for it. And one time during my senior year, one teacher said it in a nice way. He said that I'm not allowed to let you guys go to the bathroom during class, and I really had to pee. I got old enough, every time that, and I wasn't crying no more, I always made a beeline for the bathroom in between every class period, and if I didn't, it would be hell to pay, because I would end up having a major accident and peeing in my pants and having to call home and getting new clothes, which kind of sucked. Also, I had this one teacher, she knew about my health history. She knew that I cried all the time in school, and she did not agree with me leaving the room for whatever reason, whether I needed to go to the bathroom or just was crying and needed to get out of class. But if I did get out of class to go to the bathroom when I'd need to go, whether I went during in between class or what, I would still occasionally have to go even during class. And this teacher, she knew that I wasn't trying to skip school. I did not have an IEP back then saying that I needed frequent restroom use as needed, but I'm telling you, that really works. And this is my thing. I noticed that they trusted the smart kids. They got to leave class for whatever reason, and that really irritated me. I was treated like it was wrong if you had to go pee constantly. Medical problems can affect all people, and including bladder disorders. And if you're not given accommodations for a problem like IC or even autism, then it can make going to school or having a job really challenging. When I got out of school, I was determined to find out why I'd had all these bladder symptoms all my life. I knew that it wasn't going to kill me. I knew that it was benign. I just kind of got used to the idea that I was probably one of those that had bladder problems, and I never thought that a bladder problem can be disabling. When I went up to Cleveland Clinic for my autism, which was then called pervasive developmental disorder, I also saw a urologist up there, and he did an ultrasound of my bladder and kidney, didn't really find anything. He just told my mom that I had chronic urinary tract infections, but that I needed to follow up with a urologist and get further testing done. Well, we did, and I was on antibiotics for a long time for chronic urinary tract infections. And then when I was 7, I finally had a test called a voiding cystogram. That's where they take a series of x-rays of your bladder. And I'm telling you, I remember that test being really painful. And you have to hold your pee in. And at one point, it takes pictures of your bladder emptying. Well, let's just say I wiggled and squirmed my way through that test. But that test didn't confirm anything either. When I was 19, I went to another urologist, and I had a cystoscopy done. That didn't really show much other than the fact that I had just chronic urinary tract infections, and I had a little bit of irritation, but nothing out of the ordinary, just from urinary tract infections, not actually anything in my bladder to be concerned about. I decided, against my parents' wishes, that when I was 22, even though I was still on their insurance at the time, that I was going to make my first OBGYN exam because I wanted to see if there was something in the surrounding areas that could be causing my bladder problem. And I knew that an OBGYN would do a good job doing that. Mom disagreed with me going to an OBGYN because I wasn't sexually active. And she felt like the only reason that a woman should see an OBGYN is if you're sexually active and to check for cancer checks from the HPV virus. I disagreed with that. And then finally, Mom agreed and she ended up going with me to my OBGYN exam. And me and Mom described everything to my gynecologist in detail. And she really took her time and she listened to me. And she confirmed that what I described from all these symptoms that I'd had since I was little up until sounded like a condition called interstitial cystitis. And she prescribed me Elmeron for it, and I went back for regular follow-ups until I went off my dad's insurance, and I did everything that the gynecologist advised me to do about my interstitial cystitis. And a year later, she asked me, have I ever thought about applying for disability? And I said, no. And I said, well, why would I apply for disability? And she was like, IC is a debilitating condition. And I knew from the way it did to me that it can be very debilitating. The thing about IC is, even though it's very debilitating when it flares, it doesn't really get any worse. There's no cure for it. But for me, I've noticed times that it's kind of going like into a remission and then it'll just come back on you. We don't know why. It did when I was little, but then it just came back when I got older. 2 or 3 years later, I was having some more problems with my IC, and my gynecologist sent me to a urologist that specializes in IC, and that doctor said that the best thing for me to do would either to take a type of bladder medication that relaxes the bladder or try pelvic floor physical therapy. And I just went back to my gynecologist, and that urologist didn't really say anything different than what my gynecologist told me to do, other than going to physical therapy. See, both of them told me to take this medicine to relax my bladder and to help me to pee better. And I went to physical therapy for about a year. I didn't feel like physical therapy helped me as much as it should have, but the only thing that physical therapy did for me was that it helped a lot of the Vulvodynia symptoms. And for me, helping the Vulvodynia helped a lot with the IC symptoms. I still have the urinary hesitancy at times. At this point, I feel like that it's as better as it's going to get, and as long as I'm not having like the Vulvodynia type symptoms or any pain down there, I feel like I can handle the difficulty with urination and some of the other symptoms too. As long as it's better than what it was, I don't feel like that there's really any need to go back to physical therapy. because they've done all that they can do. And another thing that significantly helped my IC and Vulvodynia symptoms was doing yin yoga. When you do yin yoga, it stretches all the muscles that you would never know that were tight. Especially this one particular exercise helped it better than anything. And also, in 2017, I had a hysterectomy for my stage 4 endometriosis, and that helped some too. I just want to tell you guys this and share my IC story because September is IC Awareness Month. We should do a Q&A about it. If you feel like that there's anything wrong, and I'm telling you, do not let your family or anybody else treat you like that you can't deal with pain. And if you have any discomfort anywhere, no matter how serious it is, do get it checked out, even if it is just a minor annoyance, because it can be something that can be really debilitating, as in my case with the IC. Check out either two websites, the Interstitial Cystitis Association or the Interstitial Cystitis Network. Both of those have really good information about IC. So, I just thought I'd let you know that. You guys have a great day. And remember, if you're on the autism spectrum and you have any other symptoms, please don't hesitate to speak up. And parents and caregivers and teachers, take your child's symptoms seriously. If they complain about any other symptoms, if they're on the spectrum, they're not crazy. They're very honest about what they feel. Thank you. Bye.